vaccinated. So again, most all of this can be stopped. It should be clear to everybody that COVID-19 is still a deadly, serious issue, not just in our city, but certainly we're seeing it all over the country, especially to the states south of us. Our community had 11 COVID-19 patients in the ICU on July 10th. Today, it's 38, so almost quadrupled. Let's keep these people in our thoughts today, and let's remember that there is a simple step that most of us can take now to limit the opportunities for the virus to spread, and that is what you hear us always say is please get vaccinated. If you're not sure, and people have concerns, and their concerns are obviously legitimate, but please bring your concerns to a doctor or a pharmacist. Talk to a loved one about their experience in getting a vaccine. More people are getting vaccinated every day. We just want to see an increase in that number. Now, our city's children are returning to school this week, and we're depending on them to help us reverse this trend of rising cases. Nobody wants the disruption of an outbreak in a school building, and we're seeing this happening already in Indiana. Remember, students younger than 12 aren't yet eligible for the vaccine, and they're depending on the community to take steps to keep them safe. And that's one of the things that really bugs me is when you see young kids are safe because the adults in their life have not gotten the vaccine. That is not fair to the kids. So they're depending on us to get vaccinated. Now, the same goes for our economy. We've made some amazing gains over the last several months. We've got to protect them. We don't want to go back into any kind of shutdown mode. So we've got to be aggressive fighting the virus. Now, before we go to Connie, and speaking of the economy, I want to thank some employers and other organizations who are enacting precautions such as requiring masks indoors. Each layer of protection, whether it's the vaccine, the mask, it's important. And I want to thank the residents who have been doing the right things, who have gotten their shot, they've gotten tested, they're wearing masks, they're checking in on loved ones, and talking to their unvaccinated family and friends about their experiences with the vaccines. This is what it takes for us to get to the other side of this. And these folks are what I think are great citizens. They're not only taking care of themselves, but they're trying to take care of others as well. And these acts of citizenship, frankly, are behind the gains that we've made. And they're going to be the energy that drive us to the next step in defeating this virus as well. So when you reflect on our return to red as a city, it was completely avoidable. And a continued spike is less dependent on the virus now than it is on us because we've got the vaccine. So folks, please, if you've been holding off, make today the day where you're going to get in your car or take a walk and get the vaccine. If you don't have transportation, call somebody that you love and say, please take me to get the shot today. And you'll make a big difference here in helping our community and our kids in particular get through this. So for more specific report on the data, let's hear from Connie Mendel from our Department of Public Health and Wellness. Connie?
Dashboard. Um, and thank you, Mr. Mayor, for having me on today. And as you mentioned, we've got some really unfortunate news. We are at a high alert. We have now reached that critical red high incidence level of disease transmission in our community. As you can see, our cases, we added, we're at over 87,000 cases in Metro Louisville. We added 1,916 cases last week. That is the highest 1 week gain since February, when the vaccines were just newly available and very limited within the community. And unfortunately, we had 10 additional people die as a result of COVID. And, we're at a point where no, we should not be experiencing any fatalities on this. Our hospitalizations have increased to currently 169 people reported in Louisville Metro hospitals. That's up from 123 just last week. Our patients in the ICU is up from 37 to 47. And we've grown from 17 people on ventilators from COVID to 25. So certainly very concerning news for us and for the community. And So this is our increase in cases, and you can see this is what we do not want to see, is this steep curve on our data. And just so everyone knows, this data is readily available on LouisvilleKY.gov website. So, and fortunately, our deaths are still relatively flat, so it's not a steep increase, but given the number of hospitalizations and ICU patients and ventilators, this is very concerning for us. I guess some good news is that our vaccination rates have increased. If you see this blue line here, that does indicate residents receiving a first dose. So we did have over 7,500 people receive a first dose last week. So that is promising given how flat that had been for the previous weeks. But we still have a lot of people that we need to get vaccinated. As we look at our map for the county, we have a lot of disparity in people who are vaccinated when we look at the different areas of our county. So that we look at our vaccination rates of over 60% to 0 to 30. So currently for Louisville Metro, we've got a little over 58% of our residents have received their first dose, 445,631, and we have 50.5% of our residents that are fully vaccinated. So again, a lot of work. And here are the graphs showing our hospitalizations and patients on ICU. Again, things that we do not want to see are these steep increases, and also with ventilators. So I'm going to scroll down a little bit when we talk about who are the people that are reporting positive and suffering right now. The largest number continues to be those 20 to 44-year-olds. They are leading in our positive cases, whereas our 0 to 19 and 45 to 64 are close, pretty much tied, and that second highest group reporting positive. And we're also even seeing an increase in our 65 plus, and this is the most vaccinated portion of our population. So I'm going to stop sharing this screen quickly. So just to give a little bit of information about where people are likely to have been the 14 days prior to being positive. So these are the areas that they were likely exposed. 91% of it, we've got a lot of travel cases. So, and 91% of travel cases are those within the U.S. And some people are traveling within the state of Kentucky. We're having a lot of people have been to events like birthday parties, baby showers, sporting events and practices come up a lot in our conversations with our disease investigators, summer camps, school events, concerts, festivals, church activities, and then just general family and friends. So I know, we went for a long time without seeing people, but we are at a point now that we need to decrease those activities and be sure that we're being very safe at those. Again, wearing our masks, being sure that we're vaccinated. The travel, as far as once people became positive, if we look at the areas where they were most likely exposing others before they realized they were positive, they were still traveling, attending those events, running errands, going to work, and whether that is in retail, hospitality, healthcare, manufacturing, just basically across all of our work environments, and also, childcare and school events. Even though school is not yet open, there's a lot going on within our schools. So as a community, everyone earlier on was just doing a fantastic job of limiting those activities, limiting the infection to our friends and families and coworkers. And we've got to revert back to that, adopting those basic guidelines for mask wearing, social distancing, and vaccinations. So vaccinations are readily available. If for some reason someone is not willing or they have questions or concerns, please reach out to us. We can connect you with, a medical expert or anyone, or seek out your personal physician to answer your questions, because we want you to feel safe and reassured and knowing that the vaccine is the right thing for you. So you're welcome to contact us. We will connect you to those people, or again, speak with your personal physician. and we're approaching, unfortunately, those levels of case counts and hospitalizations that we were at our peak. So that's certainly very concerning, the Delta variant being highly contagious and transmissible. So we just got to continue that work. This is not over in curbing the spread of the disease. Last week, Dr. Burns explained how the Delta variant is an example of a virus essentially becoming smarter and finding ways to replicate, mutate, and infect as many people as possible. So, and we're seeing that in the test results and the hospitalizations and other cases. So that's just why it's so critically important for people to be fully vaccinated, like you had said, Mayor Fisher. Um, and then also that's why the CDC and there's all the guidance as far as mask wearing indoors, especially for students 12 K through 12, particularly for those students that are not able to be vaccinated. We need to protect them and their families. So again, we're asking people to wear the mask in public indoor settings. Anytime you're around people that are not in your immediate household, go back to that 6 feet of spacing for social distancing, avoid large crowds, particularly indoors, and wash and sanitize as much as possible. So, be very careful while traveling. You may want to check the rates in area. Currently, right now in Kentucky, there are only 16 of our counties that are not in the red, and those others are quickly approaching. And then I know we'll share this some information in the chat, but I always want to give our vaccine hotline number, and that's 502-912-8598. Please reach out to that number again if you have any questions, if you want to know where the vaccine is closest to you, if you need to get, we can help with travel, transportation to get vaccinated. And if you're wanting to host a vaccine event or host a medical expert or other expert to help you and your friends decide that now's the time to get vaccinated. So that's it for me. I'll be available for any questions that anyone would have.
All right. Thank you, Connie. You've got some questions already in the chat, so we'll come back to you later. Okay, now we're going to hear from one of the steady voices that have been with us throughout the entire pandemic, and that's Dr. John Klein, Vice Dean of Research at the University of Louisville School of Medicine, and has become well known in our community and around the country for his expertise here on the pandemic. So Dr. Klein, also known as the doctor, and the doctor is in. We appreciate you being with us here again today, although at one time we thought maybe this was behind us, but I think we signed off that show by saying, remember, we got to be humble to this virus because it's not done with us. So here we are with the Delta variant right now. And I know that you've been staying right in the middle of all this. So what are you hearing, Dr. Klein, from folks when they're not vaccinated? Is there a general trend or theme that you're hearing that you can explain to us and help us get through that?
I've been meeting with individuals and with groups about vaccination really throughout the pandemic. It's picked up for obvious reasons in the last month. What I find is that I have two groups of people that I talk to, at least. The first group simply is not going to get vaccinated no matter what is said or done. And there are people like that who were against all vaccinations before the pandemic. But there's a good group of people who are still persuadable and still want to have questions answered. And one of the things that I've learned personally in the last year is that when it comes to vaccination, people don't want to be talked at. They don't want to be told how effective the vaccine is and how everyone has to be vaccinated. Personally, I think what I hear the most that makes me feel optimistic is that people want to have their questions answered about the vaccine. And in that group of people who simply say, here are the reasons that I don't want to be vaccinated now, and here are the questions I have. If someone who's a trusted caregiver, a doctor, nurse, respiratory therapist in the neighborhood, answers those questions, frequently those people will go and get vaccinated. it's time intensive. It's not, as we say in the business world, scalable on an at least easily scalable. But I think that's mostly what the group of people who are there in the middle, who are still open to the possibility of vaccination, that's what they want. They want some questions answered in a non-judgmental and straightforward way.
And so you're hearing different folks bring up different concerns, obviously, at different times. And one of them now is about breakthrough cases and folks questioning the efficacy of the vaccine because they're saying, look, I mean, you're seeing breakthroughs with that, so why should I get the vaccine? So how do you talk people through the breakthrough cases? You might want to explain what a breakthrough case is as well.
So we are seeing more cases of people who are fully vaccinated, and that's to say they either got the Pfizer or the Moderna shot, and they're more than 2 weeks out from their second shot, and more of those people are beginning to have cases. The vast majority of those, and that includes the single Johnson & Johnson shot, the vast majority of those have very mild symptoms, but a few are developing serious symptoms. The way I try to explain that to people is, when it rains, we all take out our umbrellas, and vaccines are like umbrellas. And so if it's raining and it's a mild or a moderate amount of rain, the umbrella is going to keep you dry. But if you were to take an umbrella out in the middle of a hurricane, you're going to get wet because it's just not a perfect way to protect us. And in some parts of this country, people are in the middle of a virus hurricane. And so it is not surprising that the vaccines, which are umbrellas, are just not protecting us fully. They are still remarkably protective against serious illness and death. That's not to say that there won't be serious illness and death in some fully vaccinated people, but it is going to be rare, and the vaccines are absolutely essential if we want to get our lives back.
Well, I'm continuing on with that metaphor or analogy there. So what happens if I wear a raincoat under the vaccine? What's that analogous to?
Oh, okay. So we're gonna stretch this analogy as best we can, but I like that. And so yeah, that's the other thing. If it's a heavy rain, you're going to put on a raincoat. And for the metaphor that we're using, for the example, the raincoat's your mask. So you can, this is the old joke about wearing belt and suspenders at the same time. There's nothing wrong with that. You're going to be absolutely as safe as you can be to keep your pants where you want them. And the same thing applies to dealing with the virus. The combination of vaccines and masks are the tools that we have, the most common tools that we have to interrupt the pandemic and to slow it down. And so masking, particularly in indoor areas, particularly in areas with poor ventilation, is absolutely necessary given the amount of virus that we have in this community. And if you go beyond this community into counties that have very low vaccination rates, it's absolutely essential.
Yeah, and we know they work. So if that's one of your questions, it's comforting to know that between a mask and a virus, you're going to be in pretty good shape and protect your kids as well. Now, one of the things we're hearing, Dr. Klein, if you'd help us with the data on this, is folks that say, look, I've had the virus, I don't need to get vaccinated. What's the truth about that?
So the data in medical science that we have from Israel and from England, and then some new data from the United States, indicates while some measure of immunity is given to us, some protection is given to us by a previous infection, that previous infection plus vaccine is much more protective than just the previous infection. So when it came time for my own daughter, who had COVID back in November, and her husband, to ask me about what should we do about vaccination once they had recovered, I was absolutely convinced and wholehearted that they should go ahead and receive their vaccine. And I think the data is very clear that just surviving the infection does not give you a level of immunity that's fully protective. And the other thing to remember is that people who were sick in May, June, July, all the way through November of 2020 were exposed to a virus that is very, very different than the Delta virus we're dealing with now, the Delta variant. So their immunity is not as good as we would hope. So they absolutely need to go ahead and get their vaccines.
All right, now let's jump to the other end of the spectrum, and that's people saying, when can I get my booster? You know, they've gotten the shots, they feel relief because they've gotten them, and they want to stay protected. So what's the trends with boosters? Who would be eligible for them first? Any thoughts on that?
You know, one of the things you and I used to say, you know, when we were doing the Saturday shows is that we were doing something that's never been done before. We're watching science in real time. It's being reported minute to minute. And sometimes it's really fast, and that was the case with vaccines. Sometimes the data just are not fully convincing, and so science takes a little longer, and it should. And so we're waiting to hear about boosters. But I think it's pretty clear that Dr. Fauci is tipping his hand as to where boosters are going as far as the CDC and NIH opinions. Boosters are going to be first available to the most vulnerable people. And so those are people who are immunosuppressed. So those are transplant patients, cancer patients, people with autoimmune diseases. They are going to be offered the boosters, I believe, first. After that, then we're going to have enough data sometime soon as to whether people over the age of 60 or 65 need a booster, whether the aging process itself results in a loss of immunity over time. So I think we're going to hear more about boosters in the next 8 weeks. And I think we'll start to see boosters probably shortly after Labor Day into the most vulnerable populations.
Okay. And then last question, let's talk about those ages 2 to 12. When do you see that those vaccines coming along?
I honestly don't know. I know that the studies have sort of been filled, and the analysis is underway for Pfizer, and so we should hear something, but I honestly don't know an approximate date. The general feeling as to the progress of the Pfizer and other studies in children under 12 is that we're going to hear an awful lot in the month of September. And I certainly hope that's the case.
All right. Well, thank you so much. Please stay tuned for some questions coming your way, Dr. Klein. Jess, we'll throw it back to you.
Okay, thanks, Mayor. We have several questions in the chat. We'll start with the first from Mark Vanderhoff with WLKY. He asks, what kind of increase is Metro Louisville seeing among children? And to what degree can this increase be traced to spreading at daycare centers? Is there any data for the number of cases among children 12 and younger? So we'll go to Dr. Klein for the pediatric question, and then we'll go back to Connie to talk about daycare centers.
I don't have the Jefferson County data on pediatric admissions, and I think probably the journalists are going to have to ask for comment from Norton Healthcare, which has the overwhelming majority of pediatric beds in the county. I can tell you that in the region and across the country, the increase in pediatric admissions, particularly very sick children, is really disturbing. And if you go to the hottest areas of the country in terms of the virus, states like Florida and Louisiana, the numbers are really very, very disturbing. You know, I've talked about science changing its mind. Well, we want science to do that. We want it to keep sifting through the data. And way back in May of 2020, there was an opinion that was widely held that children somehow avoided this virus. And maybe with that alpha virus or the original virus, they did. But now with Delta, they absolutely do not. And we are seeing across this country very, very sick children.
Sure. And then I'll go ahead and speak to part of the daycare question. We do have a specific disease investigation and contact tracing team dedicated to daycares, which is also a reminder that we continue to do contact tracing. So please, if you receive a call or a text from one of our members, please respond to that and help us as we try to combat the disease. But our daycare team is reporting that we've seen a 2 to 3 times increase in the amount of cases and contacts being reported daycares. And this has been over the last 2 weeks. The majority of cases are coming from the same facilities, so it's more hotspots and clusters in daycares compared to across all daycares. So how many depends on, daily or weekly. So we'll see, typically 3 to 4 cases within a facility. And then, the contacts depend on how many of those students are in, various classes. So as we saw before on the dashboard and the data, the highest age group reporting cases is that 20 to 44, with the 0 to 19, the second highest group.
Thanks, Connie and Dr. Klein. Our next question comes from Haley Minogue with WHAS. She has a question about the 38 ICU patients that were mentioned at the top of the briefing. She asks, are they all at one hospital? What's the breakdown on patients at each hospital? And how many of those 38 are children under the age of 12? And we'll go to Connie for that question.
So it's not one hospital, that's spread throughout our hospital system, and that can, fluctuate daily. And another thing to remember is that those are just the COVID cases. So when we report, the ICU beds, with intensive care and ventilators, there are other patients also utilizing those beds and ventilators. So capacity is something that we continue to be, concerned about. We don't track the pediatric hospitalization data versus others. So as Dr. Klein mentioned, that would be a question to reach out specifically to those hospitals.
Thanks, Connie. Our next question comes from Yasmin Juma with WFPL. She says, with the highly transmissible Delta variant, what are the possible health risks associated with transitioning unsheltered folks from outdoor encampments to indoor shelters? And also, Mayor, a question for the city. What measures are in place to keep people safely distanced and safe at congregate day and overnight shelters? So we'll go to the mayor with that question.
All right, thanks, Jess, and Connie, you might want to weigh in on this. We know that Phoenix Health Center in particular has been tasked with working with our homeless community in terms of vaccinations. We've had about 530 individuals vaccinated at some stage in homelessness, either in encampments or when they've come to the clinic as well. So we're grateful that we're making good progress in that. And then some of the health conditions at the camps have deteriorated significantly. And so you're starting to see we're evaluating each camp to understand what the health risks are at those. For those that are being cleaned and or clear, we have caseworkers that go into the camps so that folks can understand what the transitional services are available to them through either a spot in a shelter or some other type of housing, whether they need mental health services, physical health services, those type of things. So we're taking a thoughtful approach as we move into each one of the camps. Yesterday, we also announced as one of the priority areas for the American Rescue Plan dollars, a significant amount of funding will be going to improving our homelessness situation and our affordable housing efforts as well. So I'm looking forward to that happening. So there's a lot going on in that space relative to safe distance in the congregate day and overnight shelters. I know those are protocols that the shelters are supposed to be following. I would have to really refer you, Yasmin, to our Office for Resilience and Community Services that's working that hour by hour for a more specific answer on that. Connie, if you've got any further information, please chime in.
Sure. We continue to offer vaccinations at some of the encampments. We have some scheduled for next week. And also, our shelters have been navigating COVID-19 for over a year and a half now. So they're familiar with the precautions as far as those operators and testing and contact tracing and practicing distancing. So, those, and we also continue to also work with resiliency and community services. So we had a meeting just yesterday and to help the shelters with screening and other practices. Again, providing vaccines and medical services, working with them and family health centers. And we also do have housing available to provide a safe place for those homeless who are to isolate or quarantine. So if either they're a contact or test positive.
Thanks, Mayor and Connie. Our next question is for Dr. Klein from Gladys Bautista with WLKY. She says, do you have a number on how many breakthrough cases you're seeing? If so, have you all tracked which vaccine, Pfizer, Moderna, J&J, is resulting in the most breakthrough cases?
So nationally, the number of breakthrough cases is still less than 1.5%. So you have a 98 to 99% protection. But since we now have a majority of the country vaccinated, we'll see more and more of the cases will be in vaccinated people just because of that. That doesn't change the fact that the vaccine continues, as I said, to protect us from serious infections, ICU admissions, and death. There's a lot of concern, and I understand that if you got the Pfizer vaccine, you wonder if the Moderna vaccine is better. And if you got the Moderna vaccine, you wonder if the Pfizer vaccine is better. And particularly the people that got the Johnson & Johnson vaccine, to some extent, because they only got one shot, they're concerned that it's just not as good. So far, we don't see that. There are little hints of data here and there around the world, but I think to react to those little hints would be a disservice to the overall goal of getting as many people vaccinated as possible. And so I think it's important to wait until we have more clear-cut information, particularly from Pfizer and Moderna, about whether the breakthrough cases are increasing, and if so, in which populations that they are increasing. My guess is that the slow but steady increase in breakthrough cases will prompt both the drug companies as well as the government to begin to move towards booster shots. But so far, really all we've heard is about booster shots using the original vaccines, not revised or reconfigured vaccines, using them to protect the most vulnerable people, and that is the group that I mentioned previously.
Thanks, Dr. Klein. Our next question comes from Haley Minogue with WHAS. She asks, how is our current vaccine supply in the city? We struggled in the beginning to have enough, and now I'd be interested to see if we have too much. Are we having to throw vaccine out? And we'll go to Connie for that one.
Sure. So yeah, we have adequate supply of vaccine, and we're doing everything we can to prevent vaccine from expiring. Some of the expirations have been extended by the manufacturers through testing, and that they do last longer. So we've had, fortunately, that occur. And there's also an opportunity for us to share vaccine with other providers. So we do a lot of that, whereas a smaller operation may need a smaller supply, not even, the 500 or 1,000 doses that come into a shipment. So there's a lot of communication and a lot of work. We actually are continuing to order. We just ordered additional Pfizer vaccine last week to meet our needs as we're, working to vaccinate more of the 12 to 17.
Thanks, Connie. The next question comes from Adam Raymond with Spectrum News. He has two questions. We'll start with the first for Mayor Fischer. He asks, do you think there's still more that can be done to make vaccine available to the unvaccinated? Or are we at a point now where it's all about persuasion?
I think it's primarily about persuasion at this point. There's over 100 access points in the community for the vaccine, and we'll take the vaccine to you with LouVax Mobile. So if you've got a group that needs vaccinated, just please contact us. Chris, you might want to throw up that information here again, and we're just going to keep communicating on it. And, there's some folks that don't tune into the news for whatever reason. So it's up to individuals in the community, if they know people in their friend or family circle that's like that, to talk to them about that. And Obviously, we've restarted our communication. The governor has as well. So we'll keep doing that. But as Dr. Klein emphasized, it's really kind of down to this one-to-one contact right now. And I'm grateful for the people in the community that are helping us get the word out. And LouVax Mobile, we've got a variety of special uh, sites this week as well. I don't know if we have that information to share as well that are kind of one-offs, but if you have those, please contact us, 574-2003, or at any of those numbers up there, and we'll come to you. So we're going to keep working at it. And if anybody has any ideas on other additional ways for us to communicate or additional thoughts on how we can be effective, we'd certainly like to hear those as well.
And for Dr. Klein, based on your conversations, do you think full FDA approval of the vaccine will help persuade people to get vaccinated?
So based on my conversations, people have many, many different reasons for being hesitant to get the vaccine, but one of them, and it's enough that I always pay attention to it, is the argument and the thought that this is not fully FDA approved, that it's just emergency use authorization. And as difficult as it is for people who are enthusiastic about vaccines to accept that thinking, that people are waiting for that final stamp of approval, there are people out there who are very sincere. So I expect a small increase in the number of people who are stepping forward to be vaccinated when the FDA approves probably first the Pfizer vaccine right around Labor Day. So we're only 3 weeks away, probably from full approval, maybe 4. And I think that there will be people who say, okay, now I'm ready. It's not going to be an overwhelming wave back when the vaccines peaked. We're not going to be seeing 2 million people a day in the United States, 3 million, 4 million a day. But I think it's going to have a positive effect. And as those people get vaccinated, one of the other things I've observed is that there are also people standing on the sidelines saying, I'm going to wait until the guy I work with gets vaccinated and see what happens to him. Or I'm going to wait until my uncle gets vaccinated. And there are people who are watching closely, their friends and relatives. And so there's a ripple effect. So I expect things to be a bit better when we have full approval.
Thanks, Dr. Klein. And the next question is also for you. It comes from Paul Miles with WHAS Radio. He asks, do you think many unvaccinated people don't have or regularly visit a primary care physician, specifically younger adults? How do you reach that group to give them medical advice on the vaccine?
Well, I still believe that disparities in our access to healthcare are still a barrier, but I'll leave it to Connie and the mayor to sort of flesh out the fact that, as the mayor said, we have over 100 access points. We have mobile vaccination programs that will come directly to churches and synagogues and mosques and community centers. I'm involved in these efforts, so perhaps I'm not totally dispassionate or objective about it, but I think we've done a pretty good job of trying to increase access to the vaccine. The next thing after this whole thing is over is to address those core issues of why do people have less access to healthcare? But as far as access to the vaccine, my impression is that we've done, a really good job and better than some of our peer cities. I'll point out very quickly that if you go to the CDC data and look, not that this is a football or a basketball game, but if you look at Indianapolis and you look at Nashville, 2 cities that we're always comparing ourselves to, and sometimes not feeling so good about that comparison. But when we compare ourselves to those, we actually have higher vaccination rates in all age groups. And so I think we've done okay at getting people access.
Thanks, Dr. Klein. We have 3 questions remaining in the chat. The next comes from Haley Minogue with WHAS. She said, all of this data is alarming and some of the rhetoric closely mimics right where we were in March of 2020. Are we going into another shutdown? And she asked each of you for your opinion on that. So we'll start with Mayor, and then we'll go to Connie, and then to Dr. Klein.
Two things. One is I think we've learned to manage the virus, living with the virus a little bit better. But on the other hand, if we continue to see this meteoric rise in cases that we're seeing right now in hospital usage, it's certainly a possibility. I think the big question, maybe Dr. Klein can comment on this, is how long will the Delta variant stay around? It seemed to move through the United Kingdom relatively quickly, and the state of Missouri relatively quickly compared to the original strain. So if it's hanging around and increasing like the original strain did, that's one scenario versus it moving through much more quickly. And then the third issue is we don't know if something's going to come after this as well. So those are all the issues that we're thinking about. We do continue to encourage businesses and schools to require people to mask up. Those that are requiring vaccinations, we appreciate that as well. So there's a much higher sensitivity right now in terms of what we need to do to get through this period of difficulty with the virus. Dr. Klein?
I think one of the things, maybe the only thing I've learned is to try not to predict the future with this virus. And so I can't, I can't tell you, my crystal ball, I misplaced it. I think that the good news is the mayor is right, is that the virus seems to be so infectious that it moves through communities quickly, and the curves of the virus infections going up are just as steep when the virus goes down. But it's dangerous to try and predict that being the same case here. And we're not the same as England. They have a higher, in Great Britain, they have a higher vaccination percentage. So maybe that was it. And in the state of Missouri, yeah, I agree that it burned through Missouri almost like a prairie fire. But the infections are still going on in Missouri. It's just that they're at a lower rate than they were at the peak. So I think I might be encouraged by the fact that this seems to burn through quickly and then move on. But also those places were not heading into the school year as we are. And so the reopening of school is another variable that we have to think about. So I'm sorry, I'm not going to go ahead and try and predict this. And I'm cautiously optimistic, as I am every single day.
Yeah, I would say the biggest difference between now and March 2020 is that we have the vaccine readily available. At that time, there was not a vaccine available to those. So, that continues to be the biggest defense we have towards COVID. And as Mayor Fischer mentioned, there are numerous businesses that are requiring face coverings and vaccinated staff. So hopefully that will improve where we are now. But there's still a lot of concern. So we need people to do everything they can to protect themselves.
Our next question comes from Jose Donis with Aldea. And Connie, this is for you. He says, it's summer. A lot of people are traveling. Do you foresee a big increase in cases in the next few weeks because of this? And do you think businesses will have to limit capacity in the fall?
We're already seeing a lot of travel-related cases, or at least for those people that are positive the 2 weeks before they become positive travel. So we're already seeing those trends. We're working with our schools to do everything they can to protect the students, particularly those that cannot be vaccinated, those under 12, as far as, masking and spacing and sanitation. So, whether or not, when we look at, limiting, people indoors, we'll see how that goes moving forward and how quickly this virus moves through the community.
Thanks, Connie. Mayor, we have a follow-up question from Yasmin Juma with UofL. She says, mid-pandemic, you didn't move people because of the risk of coronavirus. Why is the city displacing people from their outdoor encampments now when the highly transmissible Delta variant is making cases skyrocket?
Yeah, thanks, Yasmin. Each one of the camps goes through a risk assessment so we can determine what the various factors are going on in the camp and whether or not it's safe to uh, clear the camps at that point in time. So it's a data-based approach that we have toward that. Clearly, we've got the vaccines now, as opposed to in the peak of the crisis, with, as I mentioned earlier, some 530 folks have been vaccinated as well. And then we have caseworkers working within each one of the camps to determine what the right areas to move are. So it's just a much more comprehensive approach with more people vaccinated, combined with deteriorating health conditions in the camp that have led to what our current strategy is.
Thanks, Mayor. And this is the final question in the chat. It comes from Tara Bassett with 502 Live Streamers. She says, what are you finding is the most effective method of reaching the vaccine hesitant? Interviews with trusted providers or people who've had COVID? And Connie, we'll start with you.
So what we hear are, just like Ms. Bassett mentioned, is those people they trust. So the key influences in their community, their friends and family members that have been vaccinated and are doing well. And medical experts certainly help also. So whether it's a private physician, a community physician, but you know, it's their trusted partners and influencers in their own individual communities.
Mayor and Dr. Klein, do you have anything to add to that?
I just agree with Connie. I think people want to talk to people they trust, and that's not a criticism of experts that are on television or politicians. They want to talk to people they know, and so sometimes that means they know them from the media, but more commonly it's because it's the ICU nurse that lives next door, or the family doctor, and so I think those are the people who, in this discussion, in these later stages of the pandemic, I think have the most credibility, and above all, the ability to just listen to people's fears and concerns about the vaccine, and then to answer their questions in a way that's non-judgmental and connects at a very human level. I think the problem with that is that it's not something you can do on a mass scale. There's no drive-through counseling out at the fairgrounds, but it's still, in my experience, the best way to reach people and to change their mind about whether they're going to get vaccinated.
Thanks. And we have two additional questions in the chat that we'll try to get to. One, the first comes from Paul Miles with WHAS Radio. He says, I apologize if you've already addressed this, but will entering the red category mean additional recommendations for sporting events? Connie?
So at this point, there's not been discussion as far as limiting attendance or requiring, you know, people at sporting events to spread out. You know, I will say that given that we have so many cases going through the community right now, businesses, including sporting events, you know, they're maybe limited on employees. So they may be self-limited as far as how many people they're able to serve because they have staff quarantining or isolating, you know, due to the spread, or with their children needing to be home for them. But at this time, we're not resuming healthy at work.
Thanks, Connie. And the last question in the chat is from Tara Bassett with 502 Live Streamers. She says, in following up, how are you addressing nurses and doctors who are discouraging the vaccine? Connie, Dr. Klein, any thoughts on that?
You know, over 98% of physicians in this country are vaccinated now. And it may be higher. That's an old number that I have from at least a month ago. So while we hear from physicians and nurses who are not going to be vaccinated and are discouraging, it's really a tiny minority. And so I think the care community has voted with, with their biceps, and rather their deltoids. They've rolled up their sleeves. We hear about the very few, very, very vocal people, but that's the nature of the society we live in. Everybody has an equal megaphone because of the internet. But we know that among practicing physicians, the confidence level is extremely high.
Thanks,
And we
Dr.
know,
Klein.
I was
Go
saying,
ahead, Connie.
you know, that our local health systems are requiring vaccines for staff. So they're choosing to protect their patients who can't be vaccinated, or those that are immunocompromised and that are that would have the worst outcomes.
Thanks, Connie. And that is the last question in the chat.
All right. Well, thanks, Jess. Dr. Klein, thank you for joining us today and for the last year plus of your expertise here and helping keep our community safe. Connie, thank you as well. And for the media to continue covering this, we say thank you as well. Let's just encourage everybody that has not gotten all their answers or the questions answered yet, please do so and then decide to get the vaccine. Thanks very much, and we'll see you next Tuesday.